Back to you.
Carrie Compton with your only local look at traffic in East Texas. Time now is 6:18, and it's a startling sound, especially if you're the parent of a small child. A deep cough with a whoop sound is the sign of pertussis. It's also called whooping cough. The number of pertussis cases is rising around the country and has resulted in 2 deaths here in Texas just this year. New this morning, Alex Ositis joins us now with more on the pertussis outbreak. Alex, it sounds like parents need to be cautious this winter with it going around so it doesn't turn into something much worse.
Lane, catching the signs early and getting treatment is key here. More than a quarter of the pertussis cases in children result in a hospital stay, according to the reports we reviewed. And if the dangers for little ones aren't bad enough, it could be worse with adults in close quarters spreading the germs.
It starts like a cold, low fever, a mild cough, even a runny nose. But if left untreated, the lingering cough with a recognizable sound could lead to some serious health problems. Pediatrician Melanie Wick says adults or teenagers can be the culprits when it comes to spreading pertussis.
We can get a cough that lasts for several weeks, and we are the ones that expose those little children that have the complications to pertussis.
Wick says it's common to see more respiratory illnesses during the winter months when more people are indoors for longer times of the day. Some of the more serious complications of pertussis include pneumonia and apnea, where one stops breathing for brief periods. While pertussis has been elevated to an epidemic status by health agencies this year, primarily in California, Wick says the number of patients she sees with the illness here in East Texas is about average. Looking at the numbers for East Texas, Net Health has found 94 cases of pertussis reported in its 6-county survey, with 74 of those cases coming from Smith County. Statewide, just under 2,200 cases have occurred this year, including 2 deaths. Nearly 50% of cases have been in children under the age of 7. Wick says if it's been 10 years since your last tetanus shot, it's time to re-up and ask for the kind with the pertussis coverage as well. Another tip Wick adds is that if you're experiencing an illness, pertussis or not, use caution around others.
Certainly if you know you're sick, you've had fever, you're having cough, now's the time to stay home. You don't want to go out and spread those germs if you can help it.
Wick says in addition to staying home and keeping away from contact, you can also cut back on spreading germs by washing your hands often and covering your coughs. Lane?
Alex, so important to take those extra steps to keep your kids and your family safe. Thanks a lot for that report.